My name is Robert Zeiser. I'm the Director of Tumor Immunology at the Freiburg University Medical Center. My specific interest is in allogeneic stem cell transplantation, both in preclinical and in the clinical setting. Today, I will be reporting on unusual manifestations of acute graft-versus-host disease. The current dogma is that acute graft-versus-host disease mainly affects the intestinal tract, the liver, and the skin. However, there is increasing evidence that there are also other organs involved in this disease. For example, chronic GvHD of the kidney as a rare complication after allogeneic hematopoietic stem cell transplantation has been described. In these studies, kidney biopsies revealed membranous glomerulonephritis, and another organ that has been recently shown to be involved in graft-versus-host disease were the ovaries and the testes as a reproduction organs. And the group of Takanori Teshima from Japan showed in elegant studies that histological evaluation of the ovaries after stem cell transplantation demonstrated donor T-cell infiltration in close proximity to apoptotic granulosa cells in the ovarian follicles. This histological finding was connected to impaired follicular hormone production and maturation of the ovaries. Another unusual manifestation of GvHD is the central nervous system. First of all, different case reports and small case studies had reported that the central nervous system is involved in graft-versus-host disease. Then the group of Marcel van den Brink in nice studies could show in the preclinical setting that T cells of the donor mediate CNS GvHD and neurocognitive deficits. More recently, my group at Freiburg University investigated the role of microglia in central nervous system GvHD, and we found that in agreement with microglia activation, there were profound morphological changes of the microglia and increased MHC class II and CD80 expression on the microglia upon GvHD induction. We then used RNA sequencing-based analysis of purified microglia and detected the upregulation of tumor necrosis factor, TNF. Selective TNF gene deletion in microglia using the GvHD system showed reduced MHC class II expression and decreased CNS T-cell infiltrates. We found that graft-versus-host disease increased microglia TGF-beta activated kinase 1 called TAG1 and NF-κB p38 MAP kinase signaling. When we selectively deleted TAG1 using the GvHD system in microglia, we found reduced TNF production and microglial MHC class II expression, and also on a functional level, we found that the neurocognitive deficits were improved. So pharmacological TAG1 inhibition reduced TNF production, MHC2 expression in microglia, Th1 and Th17 T-cell infiltrates, and neurocognitive activity. We also then turned towards patient samples and studied the CNS of patients that had undergone allogeneic stem cell transplantation. Also, this study showed a role for microglia in the CNS of those patients, as we found TNF production by microglia in patients that had developed GvHD compared to those patients who underwent transplantation but did not develop GvHD. So in summary, there is increasing evidence that not only the classical organs, gut, skin, and liver are targets of GvHD, but that also other organs, such as the kidney, the ovaries, testes, and the central nervous system, have to be considered GvHD target organs. Thank you for your attention.